Yeah, probably we should start now. Welcome everybody, and good morning, good afternoon, or good evening, wherever you are. As we discussed before, this is one of the advantages of virtual meetings, that we can be wherever we are and then join this or share this session. So today we are we have an audience from different places. Where I think we're still receiving or some participants and join us, and we are making history this year again. Not only because we are doing a virtual meeting, but also because we, for the first time, I think, or as far as I know, we are having a double session with dentistry. The year, I mean, from last year, August 2020, where the last meeting was held in, was a virtual meeting, we have done a few things as a group. As you will remember, our participation was very good. I mean, the participation of the group was very good last year, and this year also we have a few presentations, and also there are some members of the group who are presented in the doctoral forum. But during the year, we have a few we had a few meetings where well attended. The group also have a series of seminars that were the webinars that were organized by the Catholic University in Chile. We were also part of the Global Partnership program. We did some presentations there during the year. And last year we had a keynote speaker for our group, which was Professor Michael Botello from the University of Hong Kong. And this year we will have, as I mentioned, a double session. In the first session will be a keynote speaker by Miss Darina Nirmalann from the University of Melbourne. And tomorrow there will be a series of presentations from schools, dental schools from the network, that will talk us and discuss their experience in teaching during the pandemic, what kind of innovation they did, etc. The other thing that happened during the year was that the group obtained a research grant to design a course on online online course for telehealth, with some basic elements for telehealth, which we did in partnership with the physiotherapy group. That course is almost ready, and we may talk about that later today or tomorrow. And on that note, I will introduce Darina Nirmalann. Darina is an oral health therapist and also is a PhD candidate at the University of Melbourne. She completed a bachelor in oral health in 2008, and also after that, a master in public health. And not happy with that, she joined the PhD program, and is well advanced in her program. And the topic of her dissertation, and also the topic of the presentation today, is the communication between the oral health professionals and the patient. How that communication is established, and the challenges for to build that the rapport between the practitioner and the patient. And this is very important because to be a good practitioner, to be a good oral health professional, you only need the clinical skills and the knowledge. You also need to develop these communication skills, and that is something that is not from my perspective, well emphasized in the curriculum. And also we can talk more about that. But this will be the topic of Darina's presentation. Her presentation is how dentists perceive and address unique patient communication challenges in general dental practice.
Hi everyone, I'm here from Melbourne, Australia, and I'm very excited to be part of the U21 annual meeting, and I really wish I could have met all of you in person. Today I will share with you a part of my PhD research results. The study was conducted in Melbourne, and I'd like to thank my supervisors at the University of Melbourne, Professor Claire Delaney, Professor Rodrigo Marino, and Dr. Rebecca Wan for their ongoing support. This presentation will be 30 minutes long, and it'll be split into 3 parts. So part 1 will be a description of the study, where I'll present the background, objectives, methodology, methods, and data analysis. Part 2 will be how do dentists experience and perceive dentist-patient communication. We'll discuss unique challenges that they face, the barriers and affordances to patient communication in dental practice. And lastly, part 3 will go through how do dentists address and respond to these unique communication challenges. And we'll talk about the implications of the study before we do the questions and answers. So part 1, description of the study. Dentistry is known to be a panic-provoking profession, and as a result, communication skills are expected competencies of general dentists. Dentists are encouraged to practice patient-centered care, as it benefits both the patient and the dentist by improving patient satisfaction, patient compliance, and in return, higher dentist job satisfaction. It also helps reduce malpractice claims, and let's be serious, no one wants to have one of those letters from a lawyer on their desk come Monday morning. So central to this is patient participation in decisions made about their dental health, and this is called shared decision making. There are many patient communication theories that tell dentists what they should do. Most of these theories draw from the medical models of communication, such as the Calgary-Cambridge Guide and Smith's Integrated Patient-Doctor Interviewing. Only recently, in 2017, the 4 Habits communication model was adapted from medicine and modified to be more suited to dentistry by adding facilitation of perceived control. It takes into account that compared to medical visits, dental visits often entail invasive treatment, likely to be associated with discomfort and patient distress, and the fact that dental visits consist of more clinical hands-on treatment compared to medical visits. However, this model still needs to be tested and validated in various clinical and education settings. However, there are still some underlying assumptions behind these theories, and these include, firstly, that the patient wants to be there, which is rare in dentistry, that the patient presents with pain and problem, which is also not always the case in dentistry, as most patients are unaware of existing dental diseases, as they're often silent in nature and do not show symptoms until it is too late. And lastly, that the patient has trust in the clinician. This research aims to qualitatively explore both barriers and affordances to dentist-patient communication via observation of everyday practice and by examining dentists' perceptions and understanding of therapeutic communication. The broader thesis research questions were: how do dentists describe and implement patient communication in daily practice? And what factors influence dentist-patient communication from the dentist's perspective? This research is qualitative. It draws from interpretivism to gain in-depth insight into dentists' individual meanings and motives when communicating with patients, and critical theory to explore the systems of power in dentist-patient interactions. This is evidenced by who controls the therapeutic agenda, who sets the direction of the communication, who speaks first, whether allowances are made for the patient to express their thoughts and feelings, and opportunities for patient involvement in the decision-making process about their treatment. There was two types of data collected: observations of dentist-patient interactions using ethnographic principles and in-depth semi-structured interviews with participating dentists. The interviews were audio recorded and were held at the dentists' workplaces. 27 dentists were recruited as we continued to interview until no new themes were identified. This sample size was also considered appropriate based on previous similar studies. A total of 66 dental appointments were observed and audio recorded. The data was analyzed using thematic analysis. The participants were a total of 10 dental clinics. There was 16 dentists working in the public sector, 11 working in private clinics, of which 7 private clinics were insurance associated. Most of the dentists worked across a variety of settings, so they worked part-time. There was a wide range of clinical experience, ranging from as little as 9 months out of dental school all the way through to 38 years of experience. They all graduated from a variety of dental schools around the world. There were different roles that they had at their workplaces. 16 were employees, 5 were associates, and 5 were the owners of the clinics. And there was a wide range of geographical locations, ranging from the centre of Melbourne, the CBD, all the way around Melbourne into the suburbs. Now on to part 2. How do dentists experience and perceive dentist-patient communication? The participating dentists were asked interview questions such as: what else influences your communication with patients in dentistry? Do you think communication in dentistry is different to other health professionals? In response, they listed a variety of factors that have been summarized in the table below. There were 3 categories: patient factors, environmental factors, and a major personal factor being lack of education in patient communication at dental school. And we'll go through each factor in the upcoming slides. First factor, patient expectations. Participating dentists described patient expectations during the dental visit and how dentists were perceived by their patients. Here are a few quotes. Participant 12: They don't see a dentist as their doctor, someone who is in the same position. They see a dentist pretty much like, as I feel, sometimes they look at you as a dental technician, you know? You have to do your practical job. Participant 14. If you go to the GP, you have a consultation normally. It is a consultation, but we will be doing a procedure as well most of the time. So the participants explained that often they're not viewed so much as a doctor, but rather a technician. And so the expectations of what happens during the appointment changes. Participating dentists described that patients often expect dental treatment to be performed at the same time as the consultation. This means that the dentist is pressured into performing a dental procedure rather being able to really focus on patient communication. And this seems to create time pressure, leading to a lack of focus on communication between the patient and the dentist, and rushing into treatment, which can often involve complex dental surgery. The scenario is different to health professionals, where a consultation takes place at a different time. Most patient communication models also designed and tested in the latter scenario, where treatment is not performed amid the consultation, reinforcing the importance of understanding the dental context when exploring dental patient communication. The next factor is negative perceptions. One of the main themes that emerged from this research was a strong perception of negativity and mistrust from patients towards them as dentists. Here are some quotes from the dentists. At least once a day, I get a patient coming in saying, "I hate the dentist," or "I haven't been in 10 years because I don't like the dentist." It's difficult because they've made up their mind already before they've even met you. Participant 8. What do they dislike the most? I can guarantee they'll say, "I hate the dentist." So dentists perceive that their patients hate them and often start the dentist-patient relationship on the back foot and need to overcome this before they can move on with the dental encounter. The quotes here indicate that dentists experience this daily, and it is a common problem for them. And there are many more quotes like this from the participating dentists in this research. Next factor is dentistry is elective and not essential. Participating dentists mentioned that dentistry is often viewed by patients and the public as elective and not essential, unlike most other healthcare services, which makes their patient communication more difficult. Here is a quote from participant 26. Dentistry mostly is perceived as, even if we don't perceive it as being elective, it is elective until someone is in pain. And usually I'm not talking to someone who's in pain at that moment. So there's always a certain elective. It is not life-threatening. Several participating dentists describe that there is a misconception amongst patients that dental treatment is not important because it is not life-threatening and not serious. During patient communication, dentists also seem to put in time and effort into explaining or educating patients on why dental treatment is necessary and not elective. They focus their attention on convincing the patient that dental treatment is important and that it is not ideal to wait for symptoms or for pain to occur. As a result, they believe that dental patient communication is different to other health professionals. Next factor. Dental problems are not visible and often asymptomatic. Participating dentists explained that dentist-patient communication is challenging because dental problems are often not visible to the patient and are often asymptomatic. Participant 14 says, "It's like they don't know what's happening because it's not like a visual. Like you will be working, they don't see what you're doing. It's more in this sense. I think they're unaware." Many dental patients present with no symptoms for their routine dental checkups and/or preventative care during which existing dental conditions are often diagnosed. Due to the high level of unawareness of existing dental diseases, dentists must spend more time convincing the patient and breaking the news of existing dental issues to the patient. They described using technology to sometimes aid their communication with patients regarding these dental conditions, such as using SLR cameras and intraoral cameras. Now on to environmental factors. Participating dentists described environmental factors that influence patient communication as being invasive and uncomfortable. Here are a few quotes. Participant 3. The physicality of the environment, the makeup of the room, the equipment, the lights, so everything about the physical room itself. This is an operating theatre. They don't declare it consciously often, but sharp things, loud things, noisy things, all have an impact. Some people find the dental chair too confining. Participant 7 said, the patient is anxious and probably only 10% of the information goes in. So the environmental factors include the invasion of personal space during dental treatment, the uncomfortable environment with sounds of drilling, smell of eugenol or cut dentine, high-frequency vibrations, and being surrounded by scary equipment such as needles and other sharp instruments. The dental chair, which patients are often sitting immediately as they enter the room. This is the place the treatment is usually performed in. So they're surrounded by anxiety-provoking dental equipment and having to lie back in a vulnerable supine position. This doesn't usually happen in other medical consultations. There's also the wearing of personal protective equipment, such as the mask, loupes or glasses, and the dental gown, which make it difficult to connect with people and can reduce nonverbal communication. The dentists described the dental environment as being viewed as uncomfortable and panic-provoking due to patient fears and being surrounded by equipment that may induce pain. One of the challenges they described when communicating with dental patients is that they are anxious, partly due to the dental environment and due to previous bad experiences. So the environment itself can trigger fears from past experiences, the smells, the sounds, seeing a needle or sharp instruments on the bracket table. As a result, the patients may not be listening or comprehending the information in that state of mind. The next environmental factor is workplace culture and values. Dentist participant number 9 described the difference between public and private clinic patient communication by distinguishing between the type of patients they see and the type of treatment they can offer. Let's read the quote. There are differences in terms of culture, linguistics, socioeconomic groups that may affect the treatment of options, which you do. And the other biggest difference, I would say, in private is the treatment options are only limited by patients' ability to pay, as well as the dentist's technical knowledge. While in public, there are certain other limitations. There are certain services, say like orthodontics, crown and bridge work, we mostly are not able to provide. This dentist is explaining that depending on the type of dental clinic you work at, your communication with the patient would change because you provide specific types of dental procedures at certain clinics. And they may be free or there may be fees for service at other clinics. So patient communication changes as a result depending on the type of clinic that the patient sees. Now, still continuing with workplace culture and values. An environmental factor that influences patient communication is more institutional and is related to workplace culture and values. In Australia, we have dental clinics that are public or private. Public clinics include government-funded dental hospitals and community centres that are mostly bulk billed or almost free for eligible Australians. The rest of the clinics are private clinics that are run mostly by dentists as a small business. Private clinics are sometimes associated with health insurances and sometimes are completely private, meaning they can charge whatever they think is fair. Participating dentists who work or have worked in both the public and private dental clinics described that their patient communication and level of patient involvement was viewed differently in public clinics in comparison to the private clinics. In the following quote, dentist participant number 27 describes his experiences working in both public and private clinics and how the different workplaces impacted his communication with patients. It's a long quote, so let's have a read. So he's referring to public clinic here. I've been warned to not let the patient kind of dictate how the appointment goes. Like they've almost developed a culture that says the patients know that they just want you to tell them what to do. I think in community health, it's more important that the patient comes in, you do the checkup, you tell them what's going on, you tell them what needs to be done, and then you organize the next appointment. Whereas at the two private clinics, it's definitely more of that level of evenness, where the dentist and the patient are the ones dictating the conversation. There are definitely issues because in some way, the patients are they're not all getting their options explored. Now on to the last factor, which is lack of education in communication at dental schools. Dentists described a major barrier to patient communication being a lack of education in patient communication throughout their dental studies and lack of development of necessary communication skills needed for clinical practice and interactions with patients. Here are a few quotes from the participants. Participant 12. I wish they taught the dental students about communication at dental school because that's something I wasn't trained in when I graduated. I found it a bit difficult. Participant number 10. The only communication training we had was probably treatment planning, but there was no real advice on speaking this tone or using these words and such, and it's not real communication training. Participant 18. We had some lectures, but they didn't seem to fit that much with what we do every day. It would have been useful to learn about building rapport with patients, gaining trust, and those sorts of things. Okay, everyone, we can have a little stretch because we're up to part 3. How do dentists address and respond to unique communication challenges? Dentists respond by either changing their communication and practice style in order to address patient factors, or they change their environment in order to address environmental factors. So how do dentists respond to patient factors? They do this by changing their communication and practice style. For example, by doing simple procedures first to ease the patient into it and build trust with the patient. Active listening rather than being focused on what they will say next. Distraction through building rapport, talking to the patient about social things or telling a story. Humor to reduce tension. Speaking a little slower to make it easier for the patient to understand them and to create a more relaxed and calm atmosphere. Physical touch on the shoulder to reassure the patient. Using layman's terms that patients are familiar with rather than technical terms. And reassurance to put the patient at ease and come across more caring and empathetic. They also change the environment. For example, by choosing to keep the door opened or closed depending on the patient. By playing music, TV, giving them headphones to help them relax. Having a separate chair or a separate consulting room rather than using the dental chair for the patient to immediately sit in. Taking their mask and glasses off to improve non-verbal communication, to create a connection and build trust. Please note that COVID-19 infection control guidelines would need to be considered when changing the dental environment, as I know that there are some restrictions. And these would depend on your local situation in your country and policies in place. A strong theme to emerge from the data was the importance of using communication to create a connection with the patient and build a relationship of trust. They want to enhance the dentist-patient relationship, to be ethical, honest, and open, and to build rapport. This allows the dentist to achieve better health outcomes, enable patient to feel safe, and to grow their business and their reputation. Here's a quote from one of the dentists. "Trust in us and in our treatment, that is the basis of the whole thing. If there's no trust, there's no point in building that relationship." Dentists also want to create a positive patient experience. This includes ensuring physical comfort, relieving pain, and managing the patient's fear and anxiety. Many of them mentioned putting them at ease and doing what they can to overcome negative perceptions of dentists. Another broader goal is to understand and manage patients' expectations, their wants, needs, and concerns. This involves setting realistic expectations for treatment outcomes, avoid surprises as much as possible, and tailor treatment to patient needs. Another broader goal, communication goal, is to provide information and education to the patient. This involves explaining patients' existing dental conditions, how to prevent them, their treatment options, and consequences of doing nothing. Lastly, participating dentists described patient communication from an obligatory and defensive angle. They stressed the importance of obtaining informed consent, avoiding complaints and litigation, discussing risks of treatment, side effects, chance of failure and success of treatment, and the pros and cons of each dental treatment option, and good post-operative advice. So now, lastly, onto implications of this research. There's a lot of studies on what dentists should do, but not many studies on how they can easily apply communication theory into practice and the unique challenges that dentists face. This research highlights some unique features about the dentist-patient communication and challenges dentists face when communicating with patients in the dental setting. To compensate for patients feeling uncertain, anxious, and distrusting, dentists have to work hard at managing patient expectations and negative perceptions, increasing patient satisfaction, building trust in a short space of time, and putting patients at ease and building those relationships. Some dentists are confident and purposeful in their approaches to manage patient expectations and work to build trust through specific communication strategies. Others find this a challenge, lacking knowledge and communication skills shown to be most effective, such as active listening and empathy. The findings have implications for dentist education and for specific type of communication work required in dental practice in order to achieve patient-centered care and shared decision-making. There is a need for more research, CPD, and education on how to reduce patient communication barriers perceived by dentists in order to enable them to achieve patient-centered care and shared decision-making in dentistry. Here's a list of some of the references from this presentation. Thank you very much for listening, and now we'll move on to questions and answers, and I welcome all of your questions. Thank you.
Thank you very much, Darina, for a very interesting presentation, and I think a very relevant topic also. I don't know what is the experience in other jurisdictions, but here in Australia, one of the, as Darina mentioned at the beginning, one of the main causes of litigation is miscommunication. I mean, because it was not clear the treatment, or it was not clear the fees that are going to be charged around that. Of course, there are other sources of litigation, but the main are this misunderstanding, and that, of course, doesn't progress. It's just I don't know, apology or something, and the thing is solved. But still, it's a situation that could be prevented with good communication. So emphasizing the need for more communication, I don't think is something. I mean, it's minor. I think should be emphasized. So I will open the floor for discussion. And if anyone has a question, please feel free to to open the mic or type your question in the chat.
Okay,
Yes.
I want to
Yep.
take the micro. I want to first congratulate Darina. I loved her presentation because it is something different from what we most of the time talk about in dentistry meetings. And this is talking about a very important aspect of our profession. And for instance, one of the first testimonies that called my attention was when people were saying that the dentist is being seen as a technician. And I wonder if that's our fault. And what I mean by that is, if we receive our patient in the dental chair, if we don't take time or enough time to go through a medical history, to really listen and ask questions about general health and go through labs or other things that are very important part of our profession, I think that contributes to what is going on with patients' perception. I don't know what you think about that, Darina, but that's what I was thinking when you tell us about that.
Yeah, that's a really good observation, because that is kind of what the results showed in the end, that, you know, if we don't focus on building relationships with our patients and like you said, talking about medical history and everything, the patients actually start thinking of us as technicians, because they think, okay, I will come, I will jump in the chair, I will open my mouth, and we start the procedure, right? So we become kind of like a technician or a robot rather than a human being. And it is so important. And like Rodrigo was saying at the start about litigation, for example, because that's just one of the factors, we know that mistakes can happen. And if we're doing a technical job, of course things can go wrong sometimes, but more and more evidence is coming out that if the patient likes you, they're less likely to go ahead with litigation. And so the only way they will like you is if they get to know you, right? If you take time to get to know them. And even if a mistake happens, they're much less likely to proceed with litigation or taking it to that level. You know, it's something that they will maybe not be happy about, but they're more likely to forgive and move on.
And I also would say minimally they will come back to you. I mean, if they don't feel that they established a good relationship, they may not come back. So,
Yeah.
so there are also financial implications of having a good communication.
Definitely.
I think Ernesto. Oh, sorry, Darina, you want to say something?
Yes.
Sorry, no, I was just agreeing with you about the financial side,
Okay.
especially if you run your own business. And I don't know what it's like in Mexico, but I know that in Australia, most clinics are small private businesses. And of course, the dentist really relies on patients coming back. Otherwise, you lose your reputation and you lose your business. So is it like that in your country as well?
It is pretty much the same thing. And of course, you need to not only think about delivering a good treatment, but also about creating rapport with your patient and a good relationship. I definitely completely agree.
Yeah. Was there another question somewhere?
Yes, Darina, thank you for your presentation. And while you were presenting, I mean, I cannot separate my two different roles. That is that I'm a teacher in a dental school and I'm also a clinician. And my question is more like a question reflection. So I don't know what you think about this. Do you think that we as teachers should include some topics in our subjects about how to ensure good communication with patients?
Yeah, I mean, absolutely. In my references, you can see there's actually quite a lot of findings of the importance of incorporating dental patient communication into the curriculum. It is starting to happen more and more around the world, but still not at a fantastic level. And you could see from my findings too, how many dentists were saying, I wish I had training on this. I wish I learned this at university. And the problem is if there is no education on this at all, they end up really struggling when they start working. Because maybe they have some confidence in the technical skills, but without communication, they can't really perform those technical skills. And they also can't explain to patients properly their options and get informed consent and get, shared decision-making and patient-centered care. They're so crucial to what we do now. So if you want a place to start, like, are you teaching anything about communication at the moment?
It's kind of a topic that we include in some subjects, for example, in the propedeutic diagnosis and how to explore the patient. I mean, it's like the first steps for the students for clinical training, but it's not like a topic itself. Like a subject itself. It's more like a topic or that we include in our subjects.
Yeah. So if you wanted to start, where to start would be, for example, I referred to the Calgary-Cambridge guidelines. Have you come across those before?
No, never.
So if you want to write that one down, because that will give you pretty much step-by-step skills that you can start teaching the students. And it, like I said, it's not perfect for dentistry because it wasn't initially made for medical students, but it has been incorporated in different health fields since then. So in dentistry around the world, it is being taught. So that could be a good guideline for you to begin with, but there are many other models as well. Yeah, so it's hard, where do you fit it in, right? But ideally, yeah, it should be a topic in itself. What has also been shown is that the way students learn communication skills the best is by role play. So if you do exercises, activities where students might get into pairs or groups, and one pretends to be a patient and one pretends to be a dentist, and then they can be an observer and they can play out different scenarios. And then, they can give feedback to each other, for example. So those kind of activities can be really, really helpful, just to start off with. Of course, if you were really advanced in training in communication, you might even hire a model an actor.
Actor.
An actor who will pretend to be a patient and actually, you know, give all sorts of different answers that the student might not be expecting, and they can practice in a safe space. But that's, I guess, more more advanced. So it just depends on what your university allows you to do.
No, well, I think in all dental school there is some element of communication, but and there is also teaching, informal teaching, when the demonstrator explains something to the student. But I think it's not the approach is not as a tool, as an instrument that you will use. And for that purpose, there is a theory behind that, and it's a structure. So I think that's the emphasis that it should have. That this is the tool that it's a professional tool that you have to use, and this is how it happens. And until you develop your own expertise and your own style of communication, but there is not something that is taught in a systematic way.
Yeah, you're exactly right, Rodrigo. And like anything, like, okay, so let's say we're teaching dental school, we're teaching them how to cut cavity preps, how to take teeth out. These are all skills that they learn. And the same thing is for communication. Communication are skills that they can learn. And, you know, it's not good enough for them to just be ad hoc learning things from their demonstrators, because the demonstrators will just be teaching them something along the way. It's not really structured. And the demonstrators themselves may have never actually received those skills training either. Maybe they just developed some skills as they practiced and from experience.
I don't know if there is any other comment.
Let me ask you a question this way, Darina. What would you do if you were the dean of your dental school and you have all this information, all these reflections? What would you do?
I would put more focus on it, because the way that the world is going, it is really, really important that we can communicate effectively, and it will improve the patient outcomes, and it will improve the dentist job satisfaction too. So I think that it needs to be a topic on its own, ideally. Ideally, instead of being just incorporated into other topics, like Ernesto, like you were saying, that it's, you know, kind of in between diagnosis and treatment planning. It ideally should be a subject on its own. But I guess the trick for you guys is finding someone who knows about it and who can teach, who can teach this subject, and then, you know, and then properly running not just lectures, but like I said, role play sessions, and inviting actors and doing more like that.
And I think I will go beyond that. I think, I mean, we have been concentrating in communication between patient and practitioner patients, but there is also a need to communication with other professional, health professional or non-health professionals. So there is, and this is one of the well, I think we will talk about this tomorrow or the day after tomorrow. The interprofessional communication, which is now one of the what's the name of this? Of the competencies that a practitioner has to demonstrate. Not only communication with the patient, but interprofessional communication, which is something that I think will be more and more in the future, talking with, I don't know, psychologists or lawyers or chemists, I don't know. So there will be a need for oral health professionals to be more involved in the case.
That's a really
the other thing.
Yeah, the good thing is when you learn communication skills, you can apply it everywhere.
Yeah, sure.
You can even apply it at home with your wife and kids. It goes across everything, you know, with your colleagues. You can use the same skills, you know.
Yeah, you mentioned about technology to improve communications. And you mentioned using infrared cameras and similar. What do you think? For example, we're using technology now to communicate to each other because of the need to do that. So, do you think that this is something that the use of technology for communication is something that will well, I suppose the answer is yes, will increase in the future. But how can this again be taught at the dental school?
Yeah, it's a really good point, because technology is a very, very good aid. Like, honestly, even in my own practice, I use my own intraoral camera with every single patient, every single case, because it's so much easier to communicate with patients if you're looking, you know, together at a picture of their tooth, for example. So the first thing, I guess, is dentists need good training in how to use cameras properly. Also, then they will need access to cameras. I don't know if all universities have cameras, but it is something that is such a great tool. It makes it really easy to explain things to patients who otherwise don't understand what is happening in their mouth. They cannot see the hole in their mouth. You know, they cannot visualize it. But also, you know, it's a legal record as well. And so if you take some photos of people's teeth, it's something that you can keep in their file. And when they say, oh, you took out the wrong tooth or something else happens, you can say, oh, no, actually, you can see this is the picture that we took before we did the procedure, and everything is there, you know? So there's so many positive things about using that. But I think also, Rodrigo, using things like this, like Zoom, telehealth, I think some dentists have started doing that a lot more during COVID, doing consultations like this. And I think that is possible, but I think only if we do have some photos that both the patient and the dentist can look at, because unfortunately, unlike other medical conditions, you can't necessarily talk about your dental condition without any pictures or seeing it. So if there was a way of patients being able to take some good photos, or even scans, like these days, there's even, you know, scans that people do, iTero scan and whatever. Even if they can take a scan or a photo, good quality photos of their teeth, potentially consultations could happen online in the future.
And that would require a new set of skills then. So probably the question is what, I mean, we have only, I don't know how long it's in Mexico, but here in Melbourne it's 4 years of, well, plus the bachelor degree, but we have 4 years of professional training, and some other schools are 5 years, 6 years. So there is a time limit for training, and you need to put all this content there. I suppose there is we have to keep a balance of what we can include, what is undergraduate and what is postgraduate, what is, you mentioned CPD, that's continued professional development, it's continued education, that's how we call it here. What is the undergraduate education, what is continued education, what is postgraduate education? So that's the challenge. And of course, I don't want to, or we don't want to portray the communication as the solution for everything of this, but I think it's something that should be emphasized and has a place in treatment patients. And the other thing I wanted to comment is that I have a couple of other projects where communication skills have been very relevant. One is was the an evaluation of the newly graduates, and that was up to 3 years of graduation, and they mentioned the need of improved communication, because well, they are young professionals, and they have to deal with sometimes with older patients, and they felt that they were not prepared to for that kind of well, unbalance in the they are not at the same level, because they were parents of children, or they were older adults, or older people, and they don't feel that they have the skill to communicate with that. They said also that they don't have the skill to deal with domestic violence when they suspect domestic violence, and that's something that is prevalent more than what we think, and our health professionals are related to that. And the other thing was that sometimes they say that they prescribe medications, in particular antibiotics, because the patient had that expectation, and they asked for that, and they didn't know, they didn't have the skill, because they were young or newly graduates, to deal with that. Jorge?
Yes, Rodrigo, I think you made a point in what you were talking about curriculum development. So we have a limited time to educate a person to be a dentist. And of course, this is a very important issue, as a lot of others, right? So I think one of the things we should probably think about is in continuing education. Not only because of the time, the limited time you have to educate a person, but also because I don't know if at the time in the dental school, they will receive this information and will have the feeling of the importance of that kind of education. I don't know if you understand what I'm saying. People will think that the very important topics will be surgery, endodontics, prosto, and this is something that I don't care. I will learn later. But when you go to a professional, when you go to a dentist that is already having some experiences, they will learn, and they will be a lot more interested in learning about this. And not actually, I was thinking not only in all the communication skills, but also even at a level of how do you build physically the distribution of your practice. Because one of the things that Darina was saying, and I completely agree, is a lot of people communicate all what they need to communicate with their patients in the dental chair. A lot of people I know, they don't even have a room, a consultation room. So I do try to separate with my patients when I'm examining them, and then I come back to the consultation room and try to explain the treatment step by step, ask if they have any questions, and all that, taking the patient out of that stressing area of the dental chair and all that equipment, I think is also an issue. So I think it's a very complex topic that could be, of course, addressed during undergraduate education, but also in continuing education, I think.
Totally.
I really agree with you as well. Yeah, continue, Rodrigo. I'll answer after. Yeah, you go.
No, here we have all health professionals, actually, not only oral health or dentists, all health professionals. I don't know in other career, but in health, professionals have to complete continuing education points, mandatory, and there is a number of hours that they have to complete, but among those hours, there had to be a course on infection control and a course on first aid. So probably would be need to put, also you have to complete some hours in communication skills.
I agree.
Yeah, but I agree with you, Jorge, about at what point in time do you start teaching students communication skills? Because what I did also find in my research that I couldn't present was that some of the dentists said that, you know, it was given too early. And at that point in time, say if it's in only first year or second year, they don't understand why do they need to learn this.
Correct.
And they really want to focus on getting their hands into it, right? They want to do their technical skills. So maybe it's smarter to do it more when they start seeing patients, you know, later in the years, maybe towards the final year more. And if they don't, I was just thinking as you were talking that maybe if they don't understand the importance, maybe it would be a good idea to have a qualified dentist come and do just like a quick presentation, or they can have some interviews with dentists who are actually working, who can explain to them what can go wrong, and their experiences with communication of why it's important. Maybe if they hear it from someone who is working, rather than just hearing it from their lecturer, maybe they will take it on board a bit more. But the timing is really important, and the CPD is so important. I think once the dentist has been practicing for 2 or 3 years and have had some difficult situations, you know, where the conversation didn't go right, the patient got upset, something bad happened, then they really want to learn about communication.
They will appreciate it, right? Of course.
Yeah.
I agree.
So they will realize it's a good investment.
Correct.
To do that. I don't know if there is any other comment or question.
I have another comment, but it's more like a comment and also another reflection. It's this takes a lot of relevance when you work special care dentistry. And when you have to communicate with caretakers, I mean, it's different that you communicate with your patient in your dental chair or in your consultation room than communicate to a caretaker or a parent, and then you work the treatments and you perform the treatments in the patient. I mean, it's kind of different. And not only for pediatric patients, but also with adult patients with a cognitive disability or something like that. So I think this topic takes a lot of relevance when you work that.
Yeah, I agree with you. It's really important to learn those other, not just with your patient, but communicating with a parent, with a guardian, with a special needs. Even I found when I was observing during my PhD, the dentists really struggled to communicate with the interpreters.
Oh, yeah.
A lot of them had interpreters and they had no idea what to do. But especially I found, you know, I was shocked that the dentist almost ignored that the interpreter was in the room completely. Like they didn't even stop their sentences to allow the interpreter to translate. So they would say, like, they would keep talking and talking and talking, and then the poor interpreter has to now translate like a whole thesis back to the patient. And yeah, it was really a struggle. And if the interpreter can't do it, well, the patient hasn't given informed consent.
No, that's something that also in countries, well, I suppose in most countries, like Australia, the students don't get training. It's mentioned, but they never get training on how to work with interpreters. I was going to comment on something else, but I forgot. No, yes. the thing is that related to the use of interpreter or working with patients or practitioners from different cultures, what the students said that, or not the students, were the demonstrators. These days we are in mid-September, end of September, and in Australia, what is happening in Australia, Darina? What's the topic of conversation these days?
Do you mean COVID related, or
no? The topic, no, sport related.
Sport related?
Yeah.
Oh yeah, everyone's talking about footy.
Yeah, everybody talk about the final. I mean, the final, on the Australian route football is I think it's a couple of weeks or next week. I don't. Well, it's very soon. But the thing is that my point was that you when you start talking with somebody, you start talking about things that are common, and an easy thing to talk is about sports because it's common to everybody. But when there are the practitioner or the patient, different culture where have no idea of Australian route football, there are no common grounds to start building that conversation and to start building the rapport. And that's why I think it's important to have a theory and to have a guideline or where to go. Yeah, that was the comment from the demonstrator that they see that the student they are very good at explaining the procedures, but then when they have a script for the procedures, but then when you take them out from the script, they are lost in what to say because they are students, so they don't have the experience of practice. By the way, if you ask me about cricket, I have no idea how cricket is played.
Yeah. Also, maybe the students don't realize that they should, students are good at following, directions. So maybe they don't realize why they need to build rapport, or maybe they don't feel safe, so they know that the demonstrator is watching and that you need to be talking about procedures. And you need to be talking about, the diagnosis and everything. Maybe they don't realize that is important as well.
And the other comment that they made was that they talk in technical terms. They don't talk in as you say, lay terms, because I don't know if they don't feel comfortable talking in lay terms with the patient, but they lost the patient because they talk in technical or explain things in technical ways.
Talking in layman's terms, I find is actually a pretty difficult skill that the dentists take time to learn after they graduate. Because I have trained many dentists, recent graduates, and it takes them a lot of time to unlearn the technical terms. It's almost like speaking a different language, because at dental school, they have to learn the technical terms and that's what they get marked on. But then when they step out and they're talking to real people, they have to now go back to talking normal terms that the patient understands, and jumping from one to the other is like jumping from Spanish to English. But that can be really hard. And so I find it takes them a good couple of years to really learn how to talk in layman's terms again.
Interesting. All right. Any other comment or question before? Well, I think this is a very interesting topic, and probably we could keep talking about this and sharing experiences, but because of the time, I think we need to close. So, Darina, thank you very much for making yourself available for this. And I don't know, where are you now in your, I should know this actually, where are you now in your dissertation? I think you're last year or
this is
last
the
month,
final
actually.
year. This will be the final year, so I'm in the write-up Yeah, so very busy with that. But yeah, luckily I collected the data before COVID because that would have really paused everything a bit. So yeah, no, it's been good.
I think you made the comment that COVID, that was before COVID, and I think COVID changed everything. I mean, for them, there will be a new set of rules after COVID.
It is true, but it's made communication even more important, I think, because now we have to compensate because we have to wear a mask the whole time. Will we do in Australia? So you have to be even better at communicating now.
Yep. Jorge, you want to make a comment? Or?
No.
I
was just cheering Darina and thanking Darina.
Yeah. No, thank you very much again. I think it was very informative and very what's the word in English? Amenois in Spanish. Well, I mean, it was a very good presentation. Not difficult to follow, or maybe that's not the right word, but it was very easy to follow presentation, and we look forward for more. I mean, for your publications coming from your thesis, and also we invite you to join this group. It's not a big group, but very friendly. So it would be good if you can join us. We have meetings, small meetings during the year, and then one big meeting like this one every year. So yes, I would send you the information. Something I forgot to mention at the beginning was to thank all the organizing committee, Veronica, Diego, and Jorge, for organizing this meeting and the whole meeting, not just the dentistry, but the whole meeting. As we were talking before, organizing this meeting is, I mean, it's very difficult. And organizing an online meeting, I think, adds other level of difficulty, because all the technical aspects has to be working, while when we have a face-to-face, there are other challenges, but not the connections and the mics, the volume. I mean, all these kind of things that are additions when we use virtual, but I think this will be the modality. This has been the modality of meetings and conferences, and I think will stay with us. So thank you very much to all the organizing committee and the organizing committee in Corina and her team in Birmingham that also provide support to us during the year. So thank you very much for that. So before we close, if anybody has any other thing to mention or discuss today. No, I don't see any hands. So as I mentioned before, tomorrow we have another session. And I think promised to be well, not as good as Darina, but good. No, would be very interesting, I think. And I think this all these discussions generate ideas for improving teaching, which is one of the objectives of this network. And I wonder if we can build on this and prepare some proposal on communication skills, maybe for next year. So we can talk during the year if we can put something together. So if there is no other comment, suggestion, or contribution, I will close it for today, and I invite you for tomorrow, which is again at this very convenient time for us. But no, it's tomorrow at the same time. And we will talk about, there will be a number of small presentation about the experience in dental education from different jurisdictions. And the other thing we'll talk tomorrow is about develop a plan for 2022. So again, thank you very much to Darina, and thank you very much to Veronica and Diego and Jorge for organizing that, and for everybody who attend and make raise some questions and participate in this meeting. So if there is nothing else, I will see you. Tomorrow.
I just wanted to say,
yes.
if anyone has any questions they haven't asked, or if they feel a bit shy to ask on this platform, you can email me as well. I think my contact details are there somewhere.
Yeah. And I think this will be uploaded in the Dentistry webpage, I suppose. Dentistry group webpage. That's the plan, or?
Yeah. Well, yeah, and then the plan is the contact from the Darina, so everything is there. Just look for it. Thank you so much, everyone.
Thank you.
See you tomorrow.
See you tomorrow.
See you tomorrow. Bye.
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 Take care.